Good evening, Cassie. Thank you for taking the time for meeting with me today. My name is Janeal Buckhalter, and I am a representative of Aspen Dental. Today's interview will last for about 15 minutes. I'll begin with a few questions about your experience and skills, then provide some information about the role in our organization.
Okay, thank you for having me.
You'll also have time to ask questions at the end. Does that sound good?
Perfect.
Okay, thank you. Okay, so excuse me. Can you tell me about a time when you worked with a patient who had dental anxiety?
Yes, I previously had a patient who came in very anxious, and I'm good at detecting or reading people, and I could sense that she was nervous. So I acknowledged how she was feeling and let her know that that was normal, and just tried to be as calm as possible and try to give her as much control as possible. And after going slowly and walking her through it, she developed some more trust and was able to get through the procedure just fine.
Okay, thank you. Can you describe a time when your schedule was very full? How did you ensure all patients received quality care?
I like to be very prepared and organized, so I like to show up early and have everything ready for the day. That way I can stay focused on the patient. So I would check in to see how they're doing, but make sure that my focus is on the patient because I've already had everything prepared.
Okay, thank you. Can you give an example of how you collaborated with a dentist or a team member to improve patient outcomes?
Okay. We had a patient that was scheduled. They needed more treatment than what they were scheduled for, so we started running behind, and I communicated with an assistant and the doctor to kind of adjust the schedule. So the assistant was able to help me turn my room over, and we were able to keep seeing the patients.
Okay, thank you. Can you tell me about a time when something didn't go as planned during a procedure? For example, like patient discomfort or the equipment issue. What happened and how did you respond?
One time we had a patient that came in upset because her temporary bridge broke, and she started to get very upset. And I had apologized to her, and um, her demeanor changed after that. So that was a good learning experience for me to understand that not everything needed immediate solution. And just acknowledging that the patient is having a problem can change their attitude.
Okay, thank you. If a patient refuses recommended treatment, but they clearly need it, how would you handle the situation?
I would try to understand why they are refusing and what their barrier is, if it was cost related or fear, and try to educate them further on the reason why we're suggesting the therapy. And if they were still to decline, I'd let them know it was their decision and it's important for their health, but I'm here when they're ready to go forward.
Okay, thank you. What would you do if you fell behind schedule but still had several patients waiting?
I would try to remain calm and prioritize what the patient's main concern was that day so that we could take care of that. And also communicate with the rest of my team members to let them know what's going on so they can inform the patients who are next that there may be a few minutes to wait.
Okay, perfect. Um, what steps do you take when identifying early signs of periodontal disease?
I would do a comprehensive assessment, which would be going over their risk factors, like if they were a smoker or have certain health concerns, and do a full charting on them. And bleeding is one of the earlier indicators that there's an issue going on. So I would pay attention to that and then just educate the patient on what I find.
Okay, thank you. And how do you educate patients on improving their oral hygiene at home?
I start by asking them what they already know and try to correct, see if there's any corrections that I can make to help them better understand the situation. And then I usually have them demonstrate what they're doing. And again, I'll just make any changes and recommendations that they might not be aware of.
Okay, okay, thank you. So at Aspen Dental, we are committed to providing high quality dental care to all patients. Our hygienists play a critical role in the patient education, preventative care, and supporting overall oral health. This position involves performing cleanings, taking digital x rays, assisting with periodontal care, and educating patients on oral hygiene. We work in a fast paced, team oriented environment and value strong communication and efficiency. We also emphasize ongoing professional development and providing support so our team members can grow in their careers. Um, okay, so now I'd like to give you the opportunity to ask any questions you may have about the role or Aspen Dental.
Okay. I did have a couple of questions. And um, okay, yes, what would the next steps be?
So the next steps would be well, we do have other applicants to interview. Once that is wrapped up, we will contact you for further steps and maybe get references and just go from there.
Okay. How many positions are you looking to fill?
We have about three dental hygienist positions to fill at this facility.
Okay. And are the hygienists required to clock out if their patient cancels?
No. It's optional. I mean, they can decide to stay. It just depends on the need that day.
Okay. Well, thank you, and I appreciate you meeting with me today.
Yes, no problem. Thank you. Thank you again for your time. It was great learning more about you and your experiences. We will be reviewing candidates and we'll follow up with you regarding next steps.
Okay. Thank
Okay,
you.
have a great day.
You too. Bye-bye.